Hello friends, welcome to Expert Medical Coding. In this video, we are going to learn about disorder of esophagus, achalasia. We are going to see what is achalasia, what are the symptoms of achalasia, what are the causes, and what are the tests performed, and what is the treatment option available for achalasia. So let's get started. What is achalasia? Achalasia is a rare disorder in which your esophagus is unable to move food and liquids down into your stomach. If you have achalasia, the LES, that is lower esophageal sphincter, doesn't relax, which prevents food from moving into your stomach. Symptoms of achalasia: trouble swallowing, heartburn, cough at night, weight loss, and hiccups. Let us see what are the causes of achalasia. It is suspected that it may be caused by a loss of nerve cells in the esophagus. There are theories about what causes this, but viral infection or autoimmune responses have been suspected. Tests which are available for achalasia are upper endoscopy, barium swallow, and manometry. Treatment options available for achalasia are non-surgical treatment options and surgical treatment options. Non-surgical treatment options are balloon dilation, medications, botulinum toxic injections, and surgical treatment options are Heller myotomy. Please like, share, and subscribe to Expert Medical Coding. Thanks for watching.